My name is Mark Green. I'm a person in long-term recovery. I work for York in Recovery CIC. We're a LERO, a Lived Experience Recovery Organisation. We're about building a community of people in recovery, looking for recovery, trying to figure out what recovery can be for them. And as part of that, we offer a range of activities and sessions, meetings, recovery cafes, which up until now have been spread around the city, but we are now the managing organisation for the newly established York Recovery Hub. It's been a journey, life's a journey, innit? I was a long-term client of drug and alcohol services for many years, in and out, you know, never really made an attempt at recovery, but I made many attempts at straightening myself out and getting well. But in 2018, things fell into place for me, and here I am, 7 years later, and I now find myself being the project leader for our LERO, our recovery organisation.
Hiya, I'm Sam. I'm the alcohol specialist nurse at York Hospital, and I am also a director for York in Recovery. I worked in acute medicine and routinely detoxed people, but not perhaps prepared them for what was coming after that. I actually fell foul to addiction myself. I'd been drinking, I would say alcoholically, for about a decade before it came to a head. I accessed my local treatment service and ended up enrolled in a 12-week community day rehab programme, and from there was introduced to York in Recovery, and for me it was exactly what I needed before I knew I needed it. Having York in Recovery as a LERO within York is a huge asset. What it brings to the table is a no expectations, welcoming, non-judgmental space for people at any stage in their journey. And it's like-minded people, just helping like-minded people. We've become a little bit of a one-stop shop in terms of we can pretty much signpost to anywhere, and that again refers back to that multifaceted approach around addiction, whereby things like homelessness, domestic violence, benefits, all these things impact somebody's ability to recover. We offer support whether people are actively in recovery, whether they're recovery curious, and if somebody relapses, it's not that you are not welcome anymore, it's you keep coming back. And that is the message that we try to drive to everybody. You know, that there isn't anything to be ashamed of. We are here, we are well, and we're going to continue to do so. And we do that at a very grassroots, basic connection level.
I think in the wider public, general population, recovery, addiction is, even in this day and age, still so misunderstood. So there's a piece of work for us and other organisations in the city in getting the message out there that recovery is possible. People can get well, anybody can get well. You've got to have the desire for it, you've got to want it, but people can get well. But as importantly, people need to understand that stigma, that little word stigma, discrimination, causes great harm great misery to people who are already suffering. So there's a piece of work for us, I suppose, you know, public information, education. We've got to change. We've got to change the perception that, you know, we're bad people. We're not bad people. Poorly people, people who are unwell, people, you know, every person I've ever met on this journey that I've been on myself, there's always a story behind it. And unfortunately, I've yet to come across any real good ones. There's always trauma, pain, poor life chances. The list goes on, the list is endless. But people can get well, people do get well, and people come back and they give back. We use that phrase, giving back, so much, because that's how it tends to work. That's what we're about, you know, as a recovery organisation. You're holding out a hand of hope and friendship, giving people a hand up. And in great part, if people move on, people progress, people are, I hesitate to use the word successful, but if people have a degree of success and getting on you know, an even keel in life, they're more than willing to hold their hand out and help the next person up.